Hi all, thank you so much for watching this video. Today we are going to discuss regarding what to do when someone is not responding. It can happen anywhere, in hospital or in public places. In hospital, a code blue is announced. When this code is announced, the medical team will attend that. But what happens if you are alone in a hospital or even in a public place? The first thing to check is scene safety. The scene should be free from any hazards or any potential threats. And the second one is for checking responsiveness. For the adult, we are tapping the shoulder. If we know the name, we are calling their name. And for the children, the same, we are tapping on the shoulder. And if we know the name, we can call by their name. And for the infant also, tap the sole of the feet. After that, if they are not responding, we have to shout for help. The purpose of calling for help is to let others know that you may need assistance. The next step is to check for pulse and breathing. During this step, we have to keep it on mind that it should not be more than 10 seconds, but we have to check at least for 5 seconds. For adult and for the children, we have to check the carotid pulse and look for the chest rise for the respiration. For the infants, we are checking at the brachial pulse and the chest rise as well for the respiration. After going through the fourth step, that is checking for the pulse and respiration or breathing, we will come to 3 conclusions. One, we will find the pulse and breathing. In this case, we have to continue observing and we have to wait for the medical team. And the second one is no breathing or abnormal breathing, but the pulse will be there. This is a scenario the respiratory arrest can happen. During this time, we are giving rescue breaths. Rescue breaths are given into the ratio or 1 breath every 5 to 6 seconds for the adults. For the pediatric and for the infant, 1 breath every 2 to 3 seconds. And the next scenario is like no pulse. At the same time, for the children and for the infant, if the heart rate is less to 60 beats per minute, is a sign of poor perfusion. During that time also, we will start CPR. Before starting CPR, we have to activate the code blue and get crash cart or AED. If you are alone, you can use the mobile if it is appropriate. At the same time, before starting CPR, I would like to emphasize a point, which the collapse, is it a witnessed one or without witness? If it is a witnessed one, and if you are alone, you can get the AED and activate the code blue at the earliest and come back and start the compression. And if you didn't witness the collapse, you have to start the compression at the same time. And after finishing 2 minutes of compression and no one is there to help, you can go and activate the code blue and get the AED. And if you are with someone in both the scenario, you can send the second person to activate the code and get the AED. During this time, you can give the compression. So, what is the compression ratio for the CPR? If there is only one rescuer, it is 13:2. That means 30 compression and 2 breaths. And if there is 2 rescuer, for the adults, it remains the same. But for the children and for the infants, it will be 15:2. That means 15 compression and 2 breaths. So how we will give the compression? Place the heel of the hand on the center of the chest and keep the palm of the other hand above that and give a compression of 100 to 120 per minute and the depth should be around 5 to 6 centimeters for the adults. For infants, draw an imaginary line between the nipples. So in that line, you can find the middle of the breastbone. Just below to that line, you can give compression. And compression can be given by 2 methods. One is 2-finger method and the second one is 2-thumb encircling technique. So for a better quality of compression, we have to remember few points. The first point is push hard and push fast. And there should not be any interruptions or minimize the interruptions. Pauses are only allowed during a rhythm analysis or a compression switches or defibrillation. And I would like to emphasize the importance of AED, which is automated external defibrillator. During the compression, a device which is called AED is applied in the patient chest to determine or evaluate the heart function. So if there is an abnormal rhythm, it will detect and it will deliver shock. All these points are taken from the BLS algorithm. Once again, thank you so much for watching this video.